Hi, I'm Morse, the founder of Core Elements Training. In this short video, we're going to demonstrate trigger point release technique, which is used within a wider sports massage or sports therapy treatment. Okay, so trigger point release is a really useful way of helping to reduce localized muscle tension. Okay, so quite often when you're working your way through a sports massage or a sports therapy treatment, you'll identify that there's parts of the muscle tissue that appear to be holding more tension than the wider tissue around it. So quite often when you press that area, then it might elicit slight discomfort for the client. We often refer to that as a trigger point or an adhesion, an area of tension. Sometimes they're very specific, okay, and they might be very localized. Other times you might find that there's a line of tension within the muscle fiber or within the wider muscle area. Okay, when you're palpating that line of tension, quite often you'll find a specific area that elicits, again, more discomfort to the client than the tension above or the tension below the region. And sometimes when you press onto those areas of tension, they might refer sensations to other parts of the body. Quite often in the gastrocnemius, they might report that they're feeling a sensation going down into the feet, or they might be feeling a sensation going up the leg. So they're referred to as trigger points because when you press them, they send a sensation to the wider area of the body. So the trigger points can often be active or latent. So with an active trigger point, these tend to be areas that when a client comes into the treatment, they'll say that they feel an ache in the leg, or they feel that there's a specific point of pain or discomfort in the leg, and they can quite often point to it. So they might point in the consultation and say, this is where it hurts. That would be considered an active trigger point. A latent trigger point is often a trigger point that isn't referring sensation anywhere to the client, and they won't feel it until you press on it. And then they'll say, oh, I didn't know I had pain there. Okay, so what we would do is essentially we're going to palpate. We might have done our effleurage and our petrissage techniques first, so we always warm the area up before we go in with heavier pressures. We're then either going to use the thumb, you could use the knuckle, or if it's a larger area, you could also use the elbow. And you're doing that to form a manual pressure. Okay, so we're going to press down. Be careful with the thumbs, especially those of you who might have hypermobile thumbs. So make sure that there's a slight bend in the knuckle, and then you're not putting too much strain on the joint above or on the joints above the thumb. So then we can then support the thumb as well here. So we're pressing down and providing a manual pressure to the area because we're going to produce an ischemic response. We're essentially pushing blood or compressing the blood flow over that trigger point area, and we're holding it for between 30 to 60 seconds. You're going to use the pain scale. So whilst you're holding that pressure, you're going to ask the client on a scale of 1 to 10, how much discomfort is that pressure causing? Hopefully they're going to come back with a number between 6 or 7. If it's around about 6 to 7, great, hold that pressure. If it's about an 8, a 9 or a 10, that's too much. The client's muscles then are going to be contracting against you and you're going to end up in a fight. So if it's about an 8, 9 or a 10, you're going to reduce the pressure slightly. So we're aiming for about that number 7, 6 or 7. If it's about a number 3, you're not on the right area or you're not compressing enough. Then after 30 to 60 seconds, we're then going to release that pressure, and then we would flush with our effleurage technique. So we would flush the area out first, and then we would go back in and we would palpate that region to see if that has reduced that muscle tension. Okay, if it has, great. If it hasn't reduced it quite enough, then we would follow up with more massage, our knuckles, our friction techniques to help to reduce that tension further. So that's one of our methods. So we identify where the trigger point is. You're either going to decide, are you using your thumb, are you using your knuckle, are you using your elbow to compress? If you're using your thumb, you're making sure that the joints are slightly bent here in order to protect them. We're not hyperextending at the joint. You're pressing down and then you're reinforcing with the other thumb. And you're going to hold that for about 30 seconds. 30 to 60 seconds. Okay, if you were using your knuckle, again, exactly the same. And then if we're doing the knuckle position, we can then reinforce with the other hand. And again, make sure that you're not putting any pressure onto your joints as well as you hold it there. Okay, if we were then using the elbow, again, we don't have as much feedback at first with the elbow. So you need to make sure, again, you're using that pain scale and then reinforce with your other hand. Okay, so the pressure is going through their elbow joint into the client and you're thinking about your own posture. Okay, you're making sure you're working between 6 and 7 on the pain or the discomfort scale, and you're holding between 30 to 60 or even up to 90 seconds. So that's our first method for trigger point technique. The other way is a 3-staged approach. Okay, so what we would then do, again, exactly the same. We've palpated, we've warmed the area up first with effleurage, petrissage techniques. Okay, and then we've identified where our trigger point is. We're going to hold, we're going to manually compress that trigger point. Okay, and then from here, after 30 seconds, we then ask the client, has that pain reduced? So first of all, we've applied the pressure, we've asked for the scale. Our client's at a number 7. 30 seconds later, we ask again. If it's now lowered to about a 4, we then push down slightly further. Okay, so we've now gone slightly deeper into the muscle tissue. We would hold it there again for about another 30 seconds. Again, ask for pain scale or discomfort scale. Has it reduced? If it has, if it stayed the same, we keep the same pressure on. If that scale has reduced slightly, we then push down again for another 30 seconds. So we're compressing the tissue, ask for pain scale, okay, stay there for 30 seconds, ask for pain scale again. If it's reduced, we press down further. So we've gone down to stage 2, ask again for discomfort scale. Then after 30 seconds again, ask the client, and then we can press again further for that final 30 seconds. So you're holding that pressure for 90 seconds, but in a 3-staged approach. Then we reduce that pressure, and again, we flush the area with our effleurage technique, working towards the lymphatic nodes or working in the direction of lymphatic flow. Okay, so that was a quick demonstration of our trigger point release method and the 2 ways that we can apply that trigger point release method using that manual compression. Okay, either applying the manual compression through the thumbs, through the knuckles, or through the elbow. Okay, so this is one of the techniques that we cover on our Level 4 Sports and Remedial Massage Diploma. If you'd like to find out more, then please visit the website, which is www.coreelements.uk.com. Thank you.